Your urine is more than just a waste product of your body. It is an important indicator of your health. Many people pay little attention to their urine, but especially in seniors, it can provide early signs of serious illness. Changes in urine are often the first warning sign before other symptoms appear. That's why it's important to know what to look out for. As we age, our bodies change. The kidneys don't work as efficiently, the immune system weakens, and diseases can develop unnoticed. By paying attention to typical changes in your urine, you can detect problems early on and prevent serious consequences. The color, smell, amount, and appearance of your urine can all provide clues. For example, dark or reddish urine may indicate bleeding or liver problems. Foamy urine can be a sign of kidney disease. Frequent or painful urination may indicate infection or other conditions. But what does this mean in concrete terms? How can you recognize the warning signs, and when should you take action? In the following chapters, you will learn everything you need to know about 6 key signs in your urine that you should never ignore. You will learn how to interpret changes correctly and what measures you should take. Claire, Vital, will accompany you on this journey with understandable information that will help you take control of your health. Have you ever noticed any unusual changes in your urine? Feel free to share your experiences in the comments. We read and respond to every message. Stay alert, because your health starts with small details. Your urine can be a life-saving indicator if you know what to look for. In the next chapter, we'll focus on urine color, what the different shades can mean and which ones you should take particularly serious. The color of your urine can reveal a lot about your health. Normally, urine is light yellow to amber in color, but if you suddenly notice other colors, you should pay attention, especially for people over 60. Changes in urine color can be an early warning sign of diseases that should not be ignored. Dark, almost brown urine, for example, can indicate dehydration. Your body needs more fluid. However, dark urine can also be a sign of liver or gallbladder problems. If the liver is not working properly, bile substances can become visible in the urine, discoloring it. It is important to watch out for accompanying symptoms such as yellowing of the skin or eyes. Reddish or pink urine should be taken particularly serious. Blood in the urine, also known as hematuria, can have many causes, from harmless bladder infections and kidney stones to more serious conditions such as bladder or kidney cancer. Sometimes the blood is only visible under a microscope, so there is no noticeable color, but any visible blood should be checked by a doctor. Green or bluish urine is unusual and can be caused by certain medications, food coloring, or infection. However, it can also indicate a bacterial urinary tract infection, which must be treated to avoid complications. Cloudy or milky urine is usually caused by bacteria, pus, or salts. This can indicate an infection or kidney problems. Here too, a thorough medical examination is advisable. Sometimes urine can appear unusually intense yellow or orange, for example due to certain vitamins or medications. These discolorations are usually harmless, but should be discussed with your doctor if they occur suddenly or are accompanied by other symptoms. How should you react if you notice a change in color? Observe how long it lasts, and whether other symptoms such as pain or fever occur. Drink plenty of water to prevent dehydration. If the change persists for more than a few days or recurs, be sure to consult a doctor. Vital recommends taking urine color seriously as a simple but important indicator of health. Feel free to share your observations or questions in the comments. Your experience can help others become more aware. In the next chapter, we'll talk about foamy urine, what it can mean and when it becomes dangerous. Many people notice foamy or heavily foaming urine, but it is often underestimated or dismissed as harmless. However, foamy urine can be a serious warning sign, especially in seniors. It often indicates that too much protein is being excreted in the urine, a condition that can indicate kidney problems. Our kidneys filter around 150 liters of blood every day and ensure that important substances remain in the body while waste products are excreted in the urine. Healthy kidneys prevent larger molecules such as protein from entering the urine. If the filtering function is impaired, These substances enter the urine and cause foam. This foam is often persistent and cannot be easily removed by quickly rinsing with water. Protein urine. The excretion of protein in the urine can be a sign of kidney disease. Diseases such as diabetic nephropathy, a consequence of diabetes, or damage caused by high blood pressure impair kidney function. Early symptoms are often nonspecific, which is why foamy urine is a valuable early warning sign. However, not all foam in the urine is immediately cause for alarm. Rapid urination with a strong stream, causing the urine to foam, or the use of certain soaps and cleaning agents, can cause temporary foamy urine. Even if you don't drink enough, your urine may be more concentrated and form foam. It is important to monitor the chain. If the foam recurs, persists, or is accompanied by other symptoms, such as swollen legs, fatigue, loss of appetite, or high blood pressure, you should consult a doctor immediately. A simple urine test can measure the protein content and provide initial indications of kidney weakness. Early diagnosis often allows for effective treatment and delays progression. Treatment may include blood pressure control, dietary changes, medication, or special therapy. A balanced diet, low in salt, adequate fluid intake, and avoidance of harmful substances provide additional protection for the kidneys. Claire Vital recommends that seniors pay attention to foamy urine and not ignore it. Your kidneys are vital, and early warning signs can give you valuable time to maintain your health. Have you ever noticed foamy urine? Feel free to share your experiences or questions in the comments so that we can provide you and others with the best possible support. In the next chapter, you will learn why blood in the urine is a warning sign that should never be underestimated. Blood in the urine, medically known as hematuria, is a disturbing and often frightening symptom for many people. Especially for seniors over 60, it is a sign that can indicate serious health problems and should therefore never be ignored. In this chapter, you will learn what causes blood in the urine, why it is important to act quickly, and how to respond correctly. Sometimes the blood in the urine is visible to the naked eye. The urine may be pink, red, or even dark brown in color. In other cases, the blood is only detectable under a microscope without you noticing any changes. Both forms should be checked by a doctor, as blood in the urine is never a normal symptom. One of the most common causes in older people is urinary tract infections, which can cause pain and bleeding. Bladder infections and kidney infections are also among the causes. In most cases, these conditions can be treated effectively if detected early. Bladder or kidney tumors are more dangerous and can be indicated by blood in the urine. In Germany, thousands of people develop bladder cancer every year, and early diagnosis is crucial for successful treatment. Therefore, blood in the urine should always be taken seriously and investigated in seniors. Other possible causes include kidney stones, which irritate the urinary tract and cause injury, as well as benign enlargement of the prostate in men, which can obstruct urine flow and cause bleeding. Certain medications or intense physical exertion can also cause temporary blood in the urine. The first step when blood appears in the urine is a thorough medical examination. This includes a urine sample, blood tests, and often imaging procedures, such as ultrasound or cystoscopy. This is the only way to determine the cause and initiate appropriate treatment. As a preventive measure, it is important to drink enough fluids to flush the urinary tract, maintain good hygiene, and seek medical advice early if infections recur. Smoking should be avoided at all costs, as it increases the risk of bladder cancer. Claire Vital would like to encourage you not to ignore blood in your urine or hide it out of embarrassment. Your health and quality of life depend on taking action early. Do you have any experience or questions on this topic? Feel free to share them in the comments. You'll be helping yourself and others. In the next chapter, you'll learn what a strong smell in your urine can mean, and when it indicates health problem. The smell of our urine is a taboo subject for many, but especially in people over the age of 60, a sudden intense or unusual urine odor can be an important indicator of health problem. In this chapter, you will learn what causes strong urine odor, when it is cause for concern, and how to respond appropriately. Urine normally smells slightly tart to neutral, depending on fluid intake and diet. However, If the smell suddenly becomes very strong, sweet, foul, or ammonia-like, this may be a sign that something is wrong. One of the most common causes of strong-smelling urine is a urinary tract infection. Bacteria multiply in the bladder or urethra and produce metabolic products that cause the characteristic, often unpleasant odor. This is often accompanied by symptoms such as burning during urination, frequent urge to urinate, or pain in the lower abdomen. Especially in older people, an infection can occur without typical symptoms, so that the odor is often the first sign. Certain metabolic disorders can also change the smell of urine. A well-known example is diabetes mellitus. If blood sugar is poorly controlled, urine may smell sweet or fruity, indicating elevated sugar or ketone levels in the urine. This is an important warning sign that should be checked by a doctor quickly. Sometimes a strong urine smell is caused by diet. Asparagus, coffee, garlic, or certain spices can cause urine to smell strong temporarily. This is usually harmless and disappears after a short time. Dehydration or fluid deficiency leads to concentrated urine with an intense odor. Therefore, drink enough water, at least 1.5 to 2 liters daily, to support your body and dilute your urine. Medications and dietary supplements can also affect the smell of urine. If you are taking new medications and notice any changes, talk to your doctor or pharmacist. Another rare but serious cause of unusual urine odor is liver or kidney failure. In this case, metabolic products can no longer be excreted sufficiently, which is noticeable in the smell. Claire Vital recommends that you consult a doctor if you notice a noticeable and persistent urine odor. A urine test can reveal possible infections, sugar levels, or other abnormalities and is the first step toward targeted treatment. Do you have any questions or would you like to share your experiences with unusual urine odor? Feel free to use the comment function. This will help you and others stay healthy. In the next chapter, we will focus on frequent or painful urination, another important warning sign that can indicate serious illnesses. Many seniors experience changes in urination as they age. Sudden, frequent, or painful urination can not only be annoying but also a sign of serious health problems. In this chapter, you will learn about the possible causes of these symptoms and how to deal with them. Frequent urination, also known as pollakiuria, means that you need to pass small amounts of urine frequently. It can occur during the day or at night. The latter is called nocturia. Frequent urination disrupts everyday life and sleep, leads to exhaustion and impairs quality of life. Painful urination, medically known as dysuria, is often associated with a burning or stinging sensation. The cause is usually irritation or inflammation of the urinary tract. In older people, the most common reasons for such symptoms are urinary tract infections, bladder infections, or prostate problems in men. Bladder infections occur when bacteria enter the bladder and multiply there. Women are more commonly affected, but men can also develop an infection. Symptoms include pain and frequent urination, as well as cloudy urine or an unpleasant odor. In men over the age of 60, benign prostate enlargement is a common cause of problems with urination. The enlarged prostate presses on the urethra, leading to frequent urination, a weak urine stream, or incomplete emptying of the bladder. This can damage the bladder in the long term and lead to infection. Other possible causes include kidney stones, bladder tumors, or neurological disorders that impair bladder function. Therefore, a thorough medical examination is essential if symptoms persist. Prevention includes drinking enough fluids and avoiding beverages that irritate the bladder, such as coffee, alcohol, or heavily sweetened drinks. Regular toilet visits and good hygiene support urinary tract health. If you notice pain, frequent urination, or other changes in your urination, you should see a doctor as soon as possible. A urine sample, ultrasound examinations, and further tests if necessary, will help to find the cause and initiate appropriate treatment. Claire Vital advises, don't just ignore such symptoms. The sooner you act, the better your chances of a quick recovery and continued quality of life. Feel free to share your experiences or questions on this topic in the comments. Your input can encourage other seniors to listen to their bodies and seek help in good time. In the next chapter, we'll take a look at cloudy urine, what the causes can be and when you should take action. Cloudy or milky urine is an unpleasant and worrying symptom for many seniors. It is often dismissed as a harmless change, but cloudy urine can be a sign of serious health problems, especially in people over 60. In this chapter you will learn about the causes of cloudy urine, the risks associated with it, and when you should seek medical advice. Cloudiness in urine is often caused by particles that alter the clear appearance of urine. These particles can come from various sources: bacteria, white blood cells, salts, mucus, or even fat. Each cause has its own significance and risk. One of the most common causes of cloudy urine in seniors is urinary tract infections. When bacteria enter the urinary tract, the immune system responds by producing more white blood cells and mucus, which combine with the bacteria to cloud the urine. This is often accompanied by a burning sensation when urinating, frequent urination, or pain in the lower abdomen. An untreated infection can spread and lead to serious complications. Kidney stones can also cause cloudy urine. Small crystals or salts can make the urine appear milky and cause pain or bleeding. If stones block the flow of urine, quick medical attention is necessary. Sometimes increased excretion of phosphates or other minerals leads to cloudiness. This is often harmless, but can also indicate metabolic disorders that require medical clarification. Another cause can be chyluria, a rare condition in which lymph fluid enters the urine, making it appear milky and cloudy. This condition requires specialized treatment. Taking certain medications or dietary supplements can also temporarily cloud the urine. If you are taking new medications and notice any changes, talk to your doctor. Dehydration or insufficient fluid intake can concentrate the urine and promote cloudiness. Drinking at least 1.5 liters of water a day helps keep the urine clear. Claire Vital recommends: if you notice cloudy urine, observe it closely and watch for other symptoms such as pain, fever, or changes in urination. If the cloudiness persists or recurs, be sure to see a doctor. Early diagnosis and treatment protect your kidneys and urinary tract from permanent damage and maintain your quality of life. Do you have any questions, or would you like to share your experiences with cloudy urine? Use the comment function to help other seniors stay alert and seek help in good time. In the next chapter we will look at changes in urine volume, what it means if you urinate too little or too much. Changes in the amount of urine are an unnoticed but important signal for many people, especially in seniors over 60. Both decreased and increased urine output can indicate health problems. This chapter explains the possible causes of too little or too much urine, and when you should take action. First, let's look at decreased urine output, also known as oliguria. If you urinate significantly less than usual, i.e. less than 400 ml per day, this may be a sign of reduced kidney function. The kidneys are then no longer able to filter sufficient fluid and waste products from the blood. Causes can include acute or chronic kidney disease, dehydration, or circulatory problems. This is particularly dangerous because the toxins remain in the body and can cause serious complications. On the other hand, there is polyuria, which is increased urine output of more than 2. This can indicate diabetes mellitus, especially if it is accompanied by excessive thirst. Certain medications such as diuretics or bladder disorders can also lead to frequent urination. Polyuria can lead to fluid loss, electrolyte imbalances, and weakness if left untreated. Nocturia, or frequent urination at night, is also a common problem for seniors. In addition to age-related changes, nocturia can be caused by heart problems, prostate enlargement, or sleep apnea. It disturbs sleep, leads to fatigue, and increases the risk of falls. Changes in urine output are often associated with other symptoms, such as pain, swelling, high blood pressure, or weight changes. These clues help doctors narrow down the cause. For self-monitoring, Claire Vital recommends keeping a urine diary. Record your daily fluid intake, the number and amount of times you go to the toilet, and any accompanying symptoms. This makes diagnosis easier and helps to detect changes early on. It is also important to drink enough, but to discuss fluid intake with your doctor if you have certain medical conditions or are taking medication. Excessive drinking can strain the heart, while too little fluid can damage the kidney. If you notice any unusual changes in the amount of urine you pass,
You should consult a doctor immediately to rule out serious illnesses or treat them at an early stage. Feel free to share your experiences or questions in the comments. This will help us raise awareness of important health issues together. In the next and final chapter, you will learn how to observe and document your urine correctly, and when you should seek urgent medical attention. Observing and documenting your urine is a simple but effective way to actively monitor your health.
Seniors over the age of 60, in particular, benefit from detecting changes early and seeking medical advice in good time. In this chapter, you will learn how to observe your urine carefully, which aspects are important, and how you can document your observations in a meaningful way. First, you should regularly check the color of your urine. As already described, it provides information about your fluid status, infections, or possible organ problems. If you notice any changes, note the color and when they occurred. Use simple color bars or urine color charts available at pharmacies as a guide. The smell can also provide clues. If your urine suddenly smells strong or unpleasant, especially if there is no explanation such as food or medication, caution is advised. Make a note of whether the smell occurs regularly or only occasionally. The amount and frequency of urination are other important parameters. Write down how often you need to go to the toilet during the day and at night, and how much fluid you consume. A simple drinking and toilet log will help you identify patterns. You should also observe the appearance of your urine: clear, cloudy, foamy, or with visible particles. Some changes are only temporary, while others can indicate serious illnesses. If you experience pain, burning, or other discomfort when urinating, record these symptoms as well. The more accurate your information is, the better your doctor can assess the cause. Claire Vital recommends using a small notebook or app to record these observations daily. This saves you from having to frantically try to remember everything during doctor's visits and helps speed up diagnosis. In addition to self-monitoring, regular medical checkups are advisable, especially if you already have pre-existing conditions such as diabetes, high blood pressure, or kidney weakness. Regular urine tests help to detect hidden problems early on. Another important issue is proper hydration. Make sure you drink enough water, but don't overdo it. Your doctor can advise you individually on the optimal amount for you. Don't be afraid to ask questions and communicate your observations openly. Your active participation is key to better health and quality of life. Do you have any tips or questions about urine observation? Feel free to share them in the comments. Together we can increase knowledge and awareness of these vital signals. In the last chapter, we will show you when you should definitely see a doctor and what preventive measures you can take to protect your kidney health. The right timing for a doctor's visit can be vital, especially when it comes to symptoms such as changes in urine. In this final chapter, you will learn which warning signs should never be ignored, when a quick medical checkup is necessary, and how you can actively maintain your kidney health in the long term. First of all, it is important to see a doctor immediately if you experience the following symptoms: visible blood in your urine, severe or persistent pain when urinating, sudden decrease in urine output, unexplained weight loss, or swollen legs and feet. Persistent cloudy or foamy urine, combined with other symptoms such as fever or general malaise, are also warning signs. If you already suffer from conditions such as diabetes, high blood pressure, or heart problems, changes in your urine should be taken particularly seriously, and regular checkups should be carried out. Early diagnosis often enables successful treatment and can prevent serious complications. Your doctor will usually carry out urine and blood tests, possibly supplemented by ultrasound examinations of the kidneys and bladder. Sometimes further diagnostics are necessary to determine the exact cause. In addition to medical care, there is a lot you can do yourself to protect your kidney health. A balanced diet low in salt, adequate fluid intake, and avoiding excessive alcohol or medication consumption are important pillars. Regular exercise promotes blood circulation and supports the filtering function of the kidneys. Avoid smoking if possible and watch your weight to avoid further strain. It is also important to take medication only as directed by your doctor and not to use painkillers or other preparations on a long-term basis.
without consulting your doctor, as they can damage the kidney. Clarivital recommends adopting a healthy lifestyle as a preventive measure to support your kidneys and reduce the risk of disease. Being mindful of your body and symptoms is the key to a long, active life. If you have any questions or would like to share your experiences, please feel free to use the comments section. Your commitment can help other seniors stay alert and seek help in good time. Thank you for joining us on this journey through the most important warning signs in your urine. Stay healthy. Take care of yourself. Your kidneys will thank you.